Thank you, and good morning, everybody. Our union, SEIU and SEIU United Healthcare Workers West, is the largest union of healthcare workers in California. We represent caregivers across the spectrum, and we are very pleased and proud to be here this morning, as was just said, as part of this historic and unprecedented coalition. On behalf of the members of our organization, we have somebody who is on the front lines as a caregiver, dealing with the people who are affected by these ill-advised and ill-proposed cuts in the current budget. And she, along with our member leaders up and down the state, are determined to pass this legislation to protect health care. So I'd like to introduce Michelle Ross, who's a member of SEIU-UHW and a caregiver at Dignity Healthcare, which is the largest provider of Medi-Cal services in the state of California. So, Michelle.
Good morning, everyone. My name is Michelle Ross, and I am a patient registration clerk at Methodist Hospital in Sacramento. Working as a registrar in the emergency room, I am one of the first faces to greet patients as they arrive. These patients are sicker today than they have ever been. And you may ask why. Well, there is only one explanation. So many of them are without access to health coverage, and because of this, they put off getting medical attention for themselves and their loved ones until they are so sick or in so much pain or are so worried about one another that they can not wait any longer. This is not right. And I know that we can do better than this. This legislation will do right by so many. The single mother whose job doesn't provide health benefits. The father with a sick child who has lost his job. And the grandmother who can't afford her medications. But if that wasn't enough, without this funding, there are likely to be a lot of layoffs at my hospital and many others. Currently, we are actually suffering from this already. With that being said, who will care for our patients? Especially the millions more to come who will finally receive coverage under the Affordable Care Act. And who will care for our families when we, the healthcare workers, are without work? People who need healthcare will suffer, and we will lose more jobs just as we are coming out of a recession that has already been so difficult on so many others. Why on earth would we allow this to happen when we have the ability to stop it? There is nothing more important than our health, and we all know that. We all have suffered tragedies in our lives, with our families, and amongst our friends and co-workers. I see it personally every day at work. California has always been known as the land of opportunity, the land where dreams can come true. So I say let's fight to provide this funding to millions, to give them the opportunity to get healthy and to stay healthy. Let's make sure that everyone, no matter their background or their income level or where they live, can look forward to a California where we all have the health care that we need and where we can continue to make our dreams come true, to live long and healthy lives. Thank you.